Hi, my name is Lauren Hafke, and today I'm going to be demonstrating how to use the ultrasound for treatment for surgical repair on the distal biceps tendon. Basically, the benefits that ultrasound can be for a surgical repair on a tendon is that it's going to increase cell permeability as well as macrophages responsiveness, and it can also increase the protein synthesis for fibroblasts and tendon cells. Okay, so patient position for this treatment, patient's going to go ahead and have their arm on the table. I want a towel underneath this just to make sure that the ultrasound gel doesn't get on the table. And then the patient's going to be sitting relaxed with their feet planted on the floor. Are you in a comfortable position?
Yes.
Okay. Okay, so treatment parameters for this specific treatment, I'm going to start with a 2 centimeter head because the treatment area is a very small area. The frequency is going to be 3 megahertz because it's superficial tissue. The intensity is going to be 0.8 watts per centimeter squared, and then the duration again is going to be 3 to 5 minutes. And then you also want to make sure that this specifically is going to be pulsed, so the duty cycle for this is going to be 20%. Before you start the treatment, you want to go over with a patient if they have any contraindications or precautions. Contraindications for ultrasound is going to be any malignancies, any blood clotting, history of blood clots, if they have cement or plastic for joint replacements, if they are pregnant, if they have a pacemaker, and then also you don't want to do this over reproductive organs or their eyes. Precautions for the ultrasound would be acute inflammation over epiphyseal plates, fractures, and then you don't want to do this for over breast implants. Okay, so to go ahead and start with this procedure, I'm going to go ahead and first clean the patient, the area where I will be treating. And then I'm also going to clean the ultrasound head. Okay. Then we're going to go ahead and apply the ultrasound gel on the head itself. You just want to cover the head a little bit just for this specific treatment. And then you're going to go ahead and place on the patient before you turn that ultrasound machine on. So then you go ahead and turn it on. And then basically you want to make sure that you're going to go in a circular motion right over that tendon and making sure that you're basically not lifting the ultrasound head, as this would damage it. Alright, so the duration for this treatment time is going to be 3 to 5 minutes, and our ultrasound went ahead and finished. So you're wanting to go ahead and clean the ultrasound head as well as cleaning the patient. The expected outcomes for this specific treatment, again, because you are increasing cell permeability, you're going to be able to decrease swelling if there was any at this specific surgery site or the site of surgery here. And then also you would measure that by looking at the girth before and after treatment. With repeated treatments, you should see that it's going to decrease the healing time, so it's going to speed it up. That way you can go ahead and help the patient move on to the proliferative stage of healing from the inflammation stage. And that's basically how you would treat or use ultrasound to treat for this specific diagnosis.